going to post this to our website. I know that there was a lot of demand for this, and we only had the capacity to accommodate 50 individuals. So you can let your fellow stakeholders know that if they would like to view this at a later time, they may check out our website, okay? And we'll provide that information to you as well. So what I would like to do now is ask you all if you could go ahead and mute yourself. That would be wonderful, because I would prefer you to mute yourself than me mute all of you. And the reason why we want you to mute yourself is just really to go ahead and cut down on that background noise. So if you look at your control panel, you'll see that you have a microphone. Go ahead and just click on that microphone with a little line through it. Wonderful. Okay, and then there's also a chat box. I see many of you have already begun to utilize that. That's wonderful. I'm going to be checking in on the chat box throughout the training. And there will also be an opportunity for you to speak up and to ask questions. And so we want an opportunity to have a little bit of dialogue. So a little more housekeeping. I do want to let you know you do have your control panel. And in there you will see a tab that says materials. I have attached a copy of today's PowerPoint slide deck for you all. Feel free to save or print out so you have that information to carry forward. We've also included the handout that we've been using in a lot of our trainings around what is a peer provider. And so it's just a really handy sheet for you to use in your own advocacy efforts or in your efforts to help educate your fellow community partners. Okay. All right. So with that, I am going to go ahead and begin. So welcome to today's leadership training, and we're going to be focusing on the National Certified Peer Specialist Certification, otherwise known as NCPS. You all know how we love our acronyms, right? So I want to tell you a little bit about our organization, give you a little bit of background, and then I'm going to hand it over to our presenter. So a little bit about Cal Voices. So we are a continuation of NorCal Mental Health America. We just went through a branding name change of recent, because we've been doing statewide advocacy and work for well over a decade. So we just thought it's time that our name fit the work that we're doing a little more appropriately. So our organization was founded in 1946. So we are just over 72 years young. We are the oldest continuously operated peer-run consumer advocacy agency in California. And we are a peer-run organization, so we specifically hire individuals with lived experience. A little bit about Access. So Access California, another acronym. So Access, it stands for Advancing Client and Community Empowerment through Sustainable Solutions. But of course, you can call us Access for short. And we are a program of Cal Voices, and we are a consumer-led statewide stakeholder advocacy program funded by the California Mental Health Services Act. So Prop $63 fund our program, and the Mental Health Services Oversight and Accountability Commission is our contract holder. I am hearing a little bit of background noise, so if you haven't placed yourself on mute, now is the time. Wonderful. Thank you. Okay. All right, so again, Access stands for Advancing Client and Community Empowerment through Sustainable Solutions. Our mission is to strengthen and expand local and statewide client stakeholder advocacy in California's public mental health system through individual and community empowerment. And our values are advocacy, recovery, and peer support. And our values have also been our annual themes, which have been our areas of focus for our research and our data collection. So when we're talking about advocacy, we're talking about meaningful stakeholder participation and active solicitation of community feedback in an ongoing manner. Expanded opportunities for involvement for all client stakeholders, and ensuring inclusion at all levels. And this includes, but is not limited to, policy development, program planning and implementation, service delivery and oversight, and as well as administration. And when we're talking about recovery, we're really focusing on ensuring the infusion of recovery principles in all aspects of service delivery, and always want to ensure that there is the client voice that is charging this, and that individuals have a choice in the services that they are offered, and that the services are individualized. So it's not a one size fits all model, as well as shared power and decision making. And we always, always, always want to advocate and continue to advocate and ensure that there's voluntary treatment always, because we know the day audit speaks to it, that we're going to have a much higher success rate if it is on a voluntary basis. Additionally, we want to really ensure that there's recovery-based training and support for mental health professionals as well. And then again, when we go back to really the data collection and the data-driven services, we want to ensure that it's good data. And what we mean by that is we want to ensure that there's tracking and reporting and analysis of recovery outcomes in all mental health programs. And really that it's the unique communities that are having an opportunity to define what those outcomes are to be measured. And then lastly, peer support. Definitely last but not least, we want to ensure, we know that the MHSA calls for the expansion, or for counties that may have not offered peer support services, the creation of peer support, right? So we want to ensure that there is actually fidelity to the evidence-based model. Although California is behind in adopting and creating a state recognized peer certification, there is so much evidence base to the model. And so the providers that are implementing peer services, we just want to hold everyone accountable and ensure that we have fidelity to the evidence-based model, as well as that we're incorporating and expanding peer providers within all mental health programs. Okay, so this includes administrative roles and direct service roles and everything else. We want to ensure that any mental health teams and programs also have a peer component. Okay, so that we always are leaning on that lived experience to help better provide more recovery-oriented services. And lastly, we want to ensure that the peer providers are making a living wage, and that they are offered, all the necessary benefits that come along with meaningful employment, such as healthcare, because we know if we're not able to take care of ourselves, it's very unlikely we're going to be able to provide the best service that we can, right? And we also want to ensure ongoing professional development, as well as opportunities for advancement, so a career ladder. Okay. All right. So now I am super excited, and I'm not seeing, let me just go through here. Kelly, are you with me? Let me have you hold on for just a moment, because I am not seeing Kelly. And we I don't want to do my grand finale if she is not even on here. Okay, here we go. Hold on one moment. This is so, yeah, I'm going to put you on mute for just a moment. All right, you all, I'm so sorry about that. I just have Kelly on the line, and she is having some technical difficulty logging in. I'm not sure what is happening on that end, but we're going to go ahead and proceed. And let me just do a sound check real quick. Kelly, go ahead and say hello, and I want to make sure folks can hear you.
All right. Hi, everyone. This is Kelly.
Can you all hear Kelly? Yes. Okay, great. Wonderful. Okay. So I'm going to go ahead and continue. So Kelly Davis, Kelly, I have your picture up right now so they can get an idea of who you are. And Kelly is the director of Peer Advocacy Supports and Services with Mental Health America. Kelly is, she's really been working tirelessly on the expansion of peer support and young adult leadership. And she is also passionate about positive psychology, civil rights, empowerment, and lived experience driven programs and policies. And in 2019, Kelly was awarded the Disruptive Innovator Award by the International Association of Peer Supporters, given to a young person making positive change in mental health through positive disruption. She is a certified yoga teacher and holds a certificate in applied positive psychology from the Flourishing Center. She is also currently pursuing her master's degree in nonprofit leadership at the University of Pennsylvania. And I have to say, she is by far one of my favorite humans, and I'm honored to have her with us today. So, without further ado, Kelly, we're gonna make this work, okay? So, do you?
Absolutely.
I've got up the first slide right now, and then you just go ahead and tell me when you want me to move on to the first your next slide, I should say.
Okay. Is it just like the national?
Yes.
Right. Okay. Yeah, we can move to the next slide. I just want to say also, it's mutual. You're one of my favorite people, but I'm really grateful to be here to talk to you all today. I apologize for the technical difficulties. I'm not sure what's happening on my end, but very excited to share with you about the National Certified Peer Specialist certification. So just for a little context, peer support has grown very rapidly over the past couple decades. In 2001, you can see there was the first peer certification out of Georgia. There were 35 certified peer specialists. And in 2019, estimated that there are over 30,000 certified peer specialists. And, peer support has expanded into so many different settings. So we have peers now, working in traditionally state hospitals or, community mental health centers, but we also have peers in mobile crisis teams, in emergency departments, in integrated care. So a lot of folks are working as part of primary care teams now. And also, right now during COVID, everybody's doing telepeer support. So there's been a lot of growth not only in terms of the actual workforce numbers, but also the areas where peers are being employed and where peers are going into themselves. Next slide. So this will not be anything that's shocking to you all on the phone. The vast majority of states have peer certification that qualifies them to bill for Medicaid services. Actually, this is from 2016. Now it's pretty much every state either has certification or is in the process. California and South Dakota, I think, are the only two. Although I know the fight for certification has been going on for years in California. But this is the state of certification across the U.S. Certainly, there are people, obviously, states who don't have formal certification. But in terms of having a certified peer specialist workforce, we're really everywhere in every state at this point. Next slide, please.
You got it.
Great. Just want to make sure. So with that, there's been a lot of challenges as well. So I'm going to contextualize this. I mean, I'll speak more broadly, but California is obviously a bit different. But some of the standards and limitations in the expansion of the peer support workforce really are one, certainly the range of training requirements, state to state, right across the country. You see, a state like Kansas that has 35 hours versus a state like New Jersey that has 108 hours of training. So there's just, in terms of state certification, there's really a vast range of the amount of training hours that folks are going through for state certification, but also obviously then the content, right, that folks are learning and being exposed to before getting started in the field. And I know in California particularly, right, it's county to county or even can be like organization to organization. Similar to training, we also see a lot of challenges around the range of experience required. So most states have no experience requirement for their certification. But again, you're looking at, most states with no experience, or a state like New York State that has 2,000 hours before you can move beyond your provisional certification. And all of this makes it, to the third point listed here, makes it very confusing for folks to anticipate the level of knowledge and experience that they're getting when they're hiring peers. So, right now, peers are predominantly paid for through Medicaid and through state and local money. But there is really an appetite for peer support and integrating peer services in Medicare, where it's currently not. Peer support is in some Medicare Advantage, but overall not in Medicare. And in private health systems and commercial insurance. Commercial insurance is an interesting. There's been a lot of growth around peer support for opioid use disorder specifically, but on the mental health side, it's really limited. And through MHA, we have our before stage 4 philosophy, which is that mental health is the only health condition or health challenge where we wait until people are in a crisis stage to provide support. So I know in my lived experience, I struggled for years before, I did so poorly that I ended up getting Medicaid. So before, when I had commercial insurance, right, I really could have benefited from peer support. And we believe that there's a lot of people who are receiving services or who are enrolled with different payers who really deserve access to the power of peer support, if they want it. And right now, with only Medicaid and state and local money, it really limits who gets access. And from their perspective, what we found was that these two things that I introduced, the just like variability in training requirements and knowledge, and the variability in range of experience requirement makes it very challenging for a payer or a system that's working across state lines, or, again, California is a bit different, but working across different areas to really feel sure about the quality and the knowledge base that they're getting depending on where they are. Next slide.
Got it.
Okay, so from the peer side, there are certainly some standards and some limitations as well. So among peer specialists, we're all familiar with the helper principle. Peer specialists research shows that they have high job satisfaction, but there's often really few opportunities for advancement in work as peer specialists. A lot of times peer support is kind of seen as a pathway to employment, which is great, and then often viewed as a kind of can be promoted as kind of a stepping stone to working as a different kind of mental health professional. 1 second, sorry, my computer is being a bit. Sorry for the technical difficulties. My computer is being also a bit strange.
No problem. We'll work through it all.
I know. Approaching each other with grace. So there's the challenges with the opportunities for career advancement. I think another major challenge for peer specialists is there's one of the biggest things that folks report when they're looking for jobs and when they're leaving jobs is, there's certainly challenges of peer support with many people having abysmal wages, but also challenges around opportunities for career advancement again. So, peers are often there's not necessarily a career ladder or a career pathway that folks can go down or go up when they're working in the field. So oftentimes this means that people who love the work or who are really awesome peer specialists often feel pushed out or end up leaving the field because there isn't necessarily a clear pathway for them to kind of advance, whether that's in leadership positions within an organization or in program design or in different things. So next slide, please.
Done.
So MHA developed the NCPS to address some of these issues. So the NCPS, first and foremost, was conceived, developed, and implemented by peer specialists. Everybody who has been on our team and who is on our team is a peer. And it was really designed to, on a broader scale, to really recognize peer specialists who have this extensive knowledge base and extensive experience that, the folks in these different settings, in these different payer groups are really looking for. And also, not just meeting the needs from the provider side, but also allowing peer specialists to kind of go above and beyond what is often kind of an entry-level credential. And at this point, there is a movement towards kind of advanced levels of certification, or at least interest. And the only state at this point who does that is Minnesota. But just to really make sure to share that the NCPS team, the ideas and the work is all rooted in lived experience and came from peer specialists. Next slide, please.
Got it.
All right. So what is it? So the NCPS is a national voluntary peer specialist certification. It's examination based. So once you're approved to take the exam, you pass or take the exam, and then you get the certification. As you can see there, there's a layout view, different some of the different pathways that folks would take. This is going to be a bit different in California because there is not the state-approved training and state certification.
So I'm sorry, Kelly, not to derail you, but I have up the NCPS core competencies.
Okay, I'm not sure why it.
I think the last one was really on the national certified, the actual exam-based requirements.
Oh, yeah.
I got that one up now. I went back. Okay.
No. Sorry.
That's okay.
yeah, just to go over, because I think it's often, what is this thing that we're talking about, right? So it's exam based, it's national and voluntary, so it's really just a way for peers to kind of go above and beyond to demonstrate this competency and experience. So the experience requirement is a minimum of 3,000 hours providing direct peer support. And this can be over the past 6 years. The peer support can be voluntary or paid. It doesn't have to be all paid. And the number 3,000 sounds really intimidating, but it's actually about a year and a half full time. And this is very similar to some of the requirements that would be for like a clinical social worker. So really, really making sure that folks have a good amount of time in the field. There's knowledge, and as you've seen already, you've gotten a sneak peek, there is 6 domains of practice that we require knowledge around. It's to create this guaranteed standard across the country, and it requires for folks in other states, state certification with a minimum of 40 hours of training, or approval of an MHA-approved training. And we work with folks to, NorCal Cal Voices training is an approved training for us. But we also work with folks in different areas to approve trainings. In the state of California, some of the trainers who we work with, and I'll get the whole list later, but intentional peer support, RI International, we just approved the share self-help training. So we really try to be flexible in helping folks have different pathways, but also rigid in the standards that we accept. Next slide, please.
And so just, I'm following the chat box, and just to kind of reiterate what you just touched on, Kelly, someone asked, actually, Tiffany Duvernay, who is one of our Access ambassadors, said if we use a 40-hour work week, then 3,000 hours of documented experience equates to 18.75 months. So our peers expected to work 18 months prior to the NCPS certification. And if you would like to answer that, and then also let me know if you would like me to hold off on relaying the questions to you and opening it up for Q&A till the end, or do you want it to go, through each slide? Do you want to?
So I think because we started a little late, I'll move a little bit more quickly. I have a frequently asked questions section at the end.
Okay.
But I'm also, I want to make sure that I get through everything, and then I'm happy to hold off on the FAQs and just actually respond to direct questions.
Okay.
Or I can go through those either. Either is definitely great, works for me. But yeah, that's correct. So it's about a year and a half full time. But you don't have to be working full time to get it. It's over a 6-year period. So a lot of folks are not working full time, or might not be volunteering full time when they're getting started in the work. So we do want to be flexible in experience is experience, right? And we want to make sure that folks are getting enough, but not be with flexibility around people's different pathways into the work. And then there's also recertification every 2 years. We require 20 hours of CEUs, and then obviously practicing according to the code of ethics. So we should be on the core competency slide. Is that right?
Yes.
Awesome. So the core competencies, they're across 6 domains of practice. We have 155 core competencies, and they follow these domains. So foundations of peer support. So things like, what are peer support? What are the SAMHSA core competencies, the INAT's ethical practice guidelines, things like that. And I think, importantly, the history and the history of the peer support movement, foundations of healthcare systems, mentoring, shared learning, and relationship building, activation and self-management, advocacy, so making sure that always stays part of peer support, and then professional and ethical responsibilities. And we have a guide that you can see on the website that I'll link and share later. It's nationalpeerspecialist.org, where you can see, yes, a breakdown of the 6 domains of practice, but also all of the core competencies, and it will break down what the questions will be about, and then how many questions there are on each topic. Next slide, please.
All right, approved trainings.
Great. So I know I mentioned a few of these. So, the Wise New training. We also work with the COPE training out of Northern California, the Mental Health Association of San Francisco. So we have a number of partners within the state. If you've taken the DBSA training, Project Return in Los Angeles. So, especially for our California folks, we want to make sure that we have trainings that are approved that are readily available to you all as well. And if you don't see your training on this list, as I mentioned, the SHARE training out of Los Angeles, we just approved today, so that's also on there. And we have an ongoing application and approval process where we go through a bunch of things with a bunch of information about the training. We review the curriculum, and then we approve or provide feedback based on. So if you're a trainer, if your training isn't listed on here, we're certainly happy to review and provide any feedback. Next slide, please.
All right, NCPS.
Yes, so just as like a summary, so it's the first national advanced certification. I think one of the things that is often confusing to folks is, we have goals around getting the NCPS acknowledged in each state. But at this point, it's really just a voluntary national certification to demonstrate your commitment to the field. So it is not a means for you. If, for example, if you wanted to get the NCPS, it's not necessarily a guarantee that if you went to Oregon, that your NCPS will be acknowledged. You would have to talk to the certification board and work through that process. Our partner is the Florida Certification Board in Florida, and they administer certifications in different states. So some states are more flexible, but want to be clear that this is really more similar to a national board certification that you would get if you were a teacher or a physician to kind of demonstrate competencies and experience. And we're really trying to anticipate the changes in the field. So, an emphasis on whole health, working alongside healthcare teams, and really helping people to manage their wellness and well-being comprehensively. In addition to making sure we're creating a pathway for leadership and a pathway for folks to kind of demonstrate that, hey, I'm exceptionally and exceedingly committed to the field, and I went above and beyond to do this different thing. It builds upon existing standards. I think one of the fears that folks had when we launched the certification was that we were going to come into states with certification and try to replace them. But, this is really about the next step, not the baseline. And then, the core competencies, but also the, ethical and professional guidelines really are how we make sure that we keep peer support as non-clinical. Obviously, there's always a lot of fear around peer support being co-opted, and I think having this peer-led, peer-operated national certification can also help us, say this is what peer support isn't, and like if I do this thing, I will lose my certification because that's not what peer support is. So that's just a kind of comprehensive to wrap it up, what it actually is, and then I'm going to go into how you get it, some of the benefits, and how we've used it so far. So next slide, please.
All right, current benefits.
All right. So current benefits of the NCPS. So as I mentioned, we're working diligently on Medicare, with private payers and health systems. But at this point, the real benefits for folks who are in the NCPS network is, one, certainly joining a network of folks from around the country. We have been doing networking sessions where folks have gotten on the phone. We've gotten on, Google Hangouts, talked about the issues that folks are seeing in their work, kind of some of the ways that they're hoping to take leadership and learning from one another. Also opportunities for broader leadership. So we do a lot of presentation and writing through MHA. We have a now over 800,000 person audience and Center for Peer Support Community. We have a lot of opportunities for folks to share through there, whether that's through our newsletter. We've been doing, twice a week webinars where we've reached over the past couple months, tens of thousands of people. So it's been a really great opportunity for some of the folks in the NCPS network to share about the things they're really passionate about with a broader community. We provide policy updates about, what we're doing and working on in the national office. We also provide research updates. There's just so much happening in the publication-wise in peer support with all of this growing interest. And so we provide ongoing updates on, a really quick summary of what the new research is saying, what's happening, what are the trends. We also have ongoing training opportunities through a learning series. So we have folks, again, from the network and from MHA do trainings. One of the recent ones we did was about, we're really passionate about positive psychology, as you heard. So it's about self-compassion, both as a peer specialist, but also for yourself. We do a conference discount for MHA's conference, and then certainly is a way to promote yourself in the field of peer support through materials we provide. And I've gotten feedback from folks with the NCPS that it's been helpful for them in leveraging their, achievement to gain additional leadership opportunities or pay within their organization. Next slide, please. NCPS practice. So what are some of the ways that we've worked on? We've done some pilots with the NCPS. So one of them was with in Northern California with Cal Voices. In an integrated care setting, we had 2 peer specialists initially, ended up saving a wild amount of money for Kaiser, but also really, really improving the lives of the people who attended the program. And now that is a formal program that is just part of what they do and has really expanded since. We also did a pilot with Hospital Corporations of America in Florida. In 2 hospitals, HCA is the largest chain of private psychiatric units in the country. So worked in their inpatient units, help people transition back into their communities, had really significant outcomes there as well. And we're currently working on, I think, as with many folks' plans, the pandemic has kind of really shifted what our process for developing our pilots, but have been in discussions with 2 health systems and then one system in a state around integrating and implementing peer work for peers who have the NCPS and been developing relationships not only with commercial insurers, but also with staffing organizations who hire peers directly, who are doing peer support, and federal and state policy. So at MHA we have a large state policy program and with our affiliate network, and have been working to get the NCPS endorsed in specific states, and then have also on the federal level been working on, particularly in the legislation in response to the pandemic, opportunities for peers broadly and NCPSs around virtual peer support and around Medicare. Next slide, please.
All right, 7 steps.
Great. So 7 steps to the NCPS. So first is verifying that you meet the requirements. So the experience and the training. Complete the application. So we have a guide on the website that'll walk you step through step what you need. It's an online application, so all of it is virtual. As part of the process, in addition to meeting the standards to take the exam, we also require a professional and a supervisory letter of recommendation. So those will go in addition to the employment verification that we do to make sure that we can verify your 3,000 hours of experience. Your professional and supervisory letters of recommendation, they will communicate directly with our credential specialist named Carla, and she'll be able to, walk you through the process should you have any questions. Next step is paying the application fee. So the application fee before you're approved to take the exam is $225. And what we've heard from different folks is many going to or asking their employers. Some people have paid out of pocket for themselves. but many employers have funds to support professional development. And I know in California specifically, you have the MHSA money that could also, you could also go to your local system or committee or local steering committee to talk about why the NCPS is valuable. And my email address is going to be at the end of this. I'm certainly happy to help and provide materials for anything like that as well. So once you pay the application fee and are approved, you schedule the exam. We have had prior to the pandemic, we had some testing locations. A lot of people, we actually have a virtual testing option that requires a computer with a webcam and then obviously internet access, and it's a really fascinating process where they are able to tell by your keystrokes it's you, and they observe you for the entire exam. So we've had the option since the start of last year to take the test virtually, but now, obviously now it's even more relevant. And I think another cool thing about the virtual testing is that you can take it anytime, any day, 24/7, and you can even pay to expedite it. So if you're like, I'm ready to take the exam, I just got approved, I want to take it tomorrow, you can also do that. Once you schedule the exam, you pay the exam fee. So the exam fee is $200. So total is $425. And again, many folks are seeking financial support from their state, from their local government, or from their organization that many of whom are investing in their professional development. Following that, you prep for the exam. We have on the nationalpeerspecialist.org website, we have an overview that has some test prep tips, but it also has, as I mentioned earlier, a breakdown of the 6 domains of practice, but also all of the core competencies that are on the exam, and including the weight, so how many questions there are on that. So you can really sit down and go through, because, with this standard and with the variation of training around the country, there will likely be things that you did not learn in training, but many folks will learn in their, thousands of hours on the job. You can go through that and see, okay, I know this might be an area where I need to do a little bit more research, or maybe watch some webinars or do some training here. But we have that guide so that you can better prepare and know what's going to be on the exam. And then the final step is taking your exam, and you'll get your results upon completion. And then you're a national certified peer specialist. So next slide, please.
Apply.
Yeah. So this is the nationalpeerspecialist.org. This is the website. We developed the NCPS, and we administer the NCPS in partnership with the Florida Certification Board. They're actually in, I think they administer certification in about 10 states now. They're about to change their name, but always want to give people the heads up, because sometimes when they see the Florida Certification Board, folks aren't sure if it's something they can do in another state. So they are our partner. We bring the peer leadership and experience perspective. They bring the psychometricians, which I don't know how to do, and the kind of folks who are really specialized in building a legally defensible and solid certification that we can make sure everything is good to go from the credentialing perspective. So I can go through quickly. Are there questions that have come up? Because I can also, we have about 15 minutes left. I can go through the FAQs, and then if folks have questions based on those, I can stop and answer them. Or were there any questions now?
There are some questions, but I'm sorry, Kelly. There are some questions, but you may answer them if you go through your FAQs. And if you don't, then
Okay.
I'll bring them up.
Okay, perfect. So I'll try to go through these relatively quickly. So,
Do you want me to move to
slide,
the? Okay, you got it.
Yeah, awesome. So here is the kind of list of the questions that we typically get. I'll go through why do we need more peers? If my state already has certification, we'll skip that one. We'll skip the next two. And why doesn't commercial insurance cover peers? $3,000 is a lot. And then the obviously large question that always comes up around, certified peer support is the question around qualification. So next slide, please.
Okay.
So I hope that everyone on this call is pretty sold on this idea, but why do we need more peers? So, there's in mental health, in behavioral health right now, there's a massive shortage of mental health providers. And oftentimes, even when resources are available, they're not engaging or they're not provided in a way that's really empowering for folks. So peers provide a really great opportunity to really emphasize, whole health and what are the things that really matter to people? How do you really engage people and connect them with services without just focusing on clinical scales, right? What is really valuable to individuals, and how can we use this investment and current interest in the peer support workforce? Oftentimes peers are really changing organizational culture when they're going and working in different settings. How do we really build out the peer workforce so we're changing more than just organizations? We're changing the broader philosophy and perspective of the field of mental health and mental health services too. So, there's a lot of evidence of peer support short-term and long-term impact, keeping people working, keeping people in their communities. And then certainly, as I mentioned earlier, really a lot investing in and expanding the peer support workforce is also really in line with MHA's emphasis on the idea of before stage 4. So prevention and early intervention services, making sure that folks don't, I often say, I don't want you to join the club that I'm in. I don't want you to be traumatized by, your experience in mental health services, or to have to struggle for as long as I did without getting access to something that, folks with lived experience knew would be really beneficial to me. So making sure that we have more peers to reach people earlier as well. Next slide, please.
Okay.
Go through this one quickly. Why do we need this if my state has certification? Obviously, this is different from California. But again, I never tell folks in other states to not get the state certification. State certification is still necessary for Medicaid reimbursement in those states. We, are working on the advancement of the peer workforce, and one of those ideas is tiered reimbursement. So that is for folks who attain higher levels of certification, using that as a kind of point to increase reimbursement rates or pay. This is something that's already happening in Minnesota. Minnesota has a level 1 and level 2 peer specialists, and it's something that a lot of other states have been looking into. And we believe that, this can incentivize folks to stay in the field, but also all peers do incredibly valuable work, both in terms of outcomes and savings to systems. And we want to make sure that peers are encouraged to stay in the field, but also reimbursed adequately. And again, the NCPS is really trying to create this national standard that's reliable, and folks in Medicare, commercial insurance, and any kind of payer or system that works across state lines can rely upon. Next slide, please.
All right. Will this replace my state certification?
Not for you all. But yeah, so state certification is the starting point. There's, and as I mentioned, increased movement towards tiering levels of peer support can fill gaps in states like California that don't have certification. So, I think, and what I've heard from a lot of folks in the state is that this has been a really powerful and maybe empowering way for them to say, I am a certified peer specialist with a formal certification.
And really, I just want to echo that, it really does. And I touched on this earlier, how important it is for us to really uphold the evidence base around peer support. And I feel that this is one opportunity for us to tap into while we're waiting for the state to get it together. All right. Why don't commercial insurers cover peers?
There's a lot of interest, but limited expansion. So there's an increased interest, particularly around substance use disorders, opioid use disorders. There are commercial payers who are paying for predominantly telephone-based peer support, but this is in small pockets and it's not really large scale. And in our conversations, I didn't mention this, we started developing the certification in 2014, 2015. We launched in 2017, and it's been a consistent response that we've got from payers is that there's just too much variation in standards across the country. So it's hard for them to really feel like they can be sure that they're getting the same thing, folks with the same high standards, no matter where they are. This is kind of a similar. We're addressing these concerns because it's not, not just creating a uniform standard, but it's also a high standard because there's definitely value to having low barriers to entry into the workforce, but I think there's also value to really making sure that we create additional standards for folks who want to stay in the field and can really demonstrate, this is a real discipline with folks who are committed to the work and who have really significant lived experience, professional experience, and knowledge. I think part of what's of interest to them too is obviously this broader movement towards early intervention and getting people resources earlier, and also this understanding that there's just such limited support for folks that we need to be creative in investing in, what mental health and well-being support looks like. And not to get off topic, but peer support, in mental health, the peer support is really also has been powerful and is growing across other health conditions too, whether that's diabetes or cancer or different things. Next slide, please.
Got it.
So we did go over this. So is it 3,000 hours a lot? Why so much training? 3,000 hours is a lot, but it's also, 1.5 years full time, which many people in the field have. And again, we don't have a requirement that you have to be working full time for, however long to get the NCPS. They can be all volunteers. We have that flexibility. There's no requirement that it's paid, and we have a 6-year window. So I really
want you to, I want to make sure that people understand what you're saying, that it doesn't have to be employment, that the volunteer hours that folks are racking up count. And so we want to make sure that, and they have 6 years to achieve the 3,000 hour mark. So there is a lot of a lot of folks that meet that qualification.
Mm-hmm. Yeah, definitely. And the only standard is that we have to be able to verify.
Right.
But yeah, I think it's very accessible for a lot of people who have been doing this work, especially over a 6-year period, definitely.
And that answers one of the questions you had in the chat box.
Great. Awesome. I anticipated one. Wonderful. So, as I mentioned earlier, the 3,000 hours is comparable to other professions. And for the training, and you'll see if you check out the competencies document, is that we go beyond what is in a lot of standard training to include things like adult learning, the impact of trauma and how to provide trauma-informed peer support, understanding insurance and health systems. And whole health, we're really trying to prepare peers. There's a big movement towards getting peers as part of, integrated care teams, peers working in primary care. We want to make sure that we are supporting folks by making sure they have the knowledge base necessary before they're going into a new setting. And then, need to be prepared for increased opportunities. Folks have been anticipating for years that there's going to be a big influx in the peer support workforce. There's been a lot of interest, and I think with what we're going to see in terms of the impact of the pandemic and likely economic impact of the pandemic, that there will be a lot of folks who really, really will need support, and that peers in their approach to how they engage people and how they understand systems and how they how they support people to maintain their own well-being and to build connections and to discover, not just the clinical stuff that folks care about and get services around, but like really like what would empower you to live a life that you wanted to live. I think is going to be really important and likely a big. I'm seeing at the federal level and policy in particular a big interest to folks. And then last slide.
Okay.
So won't this make peers mini clinicians? So this is I think an important way to not make peers mini clinicians is to really make sure that folks are equipped with this additional knowledge base, but also because the certification really does emphasize the principles and guidelines and core values of peer support and all of the things that the history of peer support has taught us. All of the ways of approaching and engaging folks, and that increasing knowledge, increasing skill sets only improves the work that peers are doing, how equipped and supported they feel in their work, but also how they're able to be of service to others. And I think additionally, having really strong standards around ethics and professional responsibilities, particularly that are developed from within the peer support world, are really important, and provide guidance for employers and for folks who are not peer specialists on like, this is where you can say, this is what I do, this is what I don't do. And, I can show you and explain to you, like in my credential, like this is how I maintain the ethics of peer support. And this is how we as a community, by developing things through the peer lens and from the peer perspective, can really try to fight against this fear around co-optation. And next slide, please.
Okay.
So this is, again, the website. So it's nationalpeerspecialist.org. Additionally, MHA runs the Center for Peer Support. It's at centerforpeersupport.org. And there you can find information about research and peer support. We have a really cool documentary that my boss, Patrick Henry, developed about the history of the peer support movement, the history of peer support on there, organizational and like workplace reports. So we have a lot of great stuff on there, and webinars. There's a lot of cool stuff around peer support. So definitely also check that out. We have a newsletter as well where we put out resources and updates on all the things that are going on. And next slide, please, which is my last slide.
Okay.
So this is how you stay in touch with MHA, and this is how you get in touch with me. So that's my email address. Again, I'm Kelly. Email just kdavis@mhanational.org. I am so happy to answer any questions that you might have. As I mentioned earlier, if you want resources or support around talking to your employer, around talking to the leadership in your community about the NCPS, I'm very happy to provide that or be of support or service in any way that I can. And I just wanted to say, take the time to thank you all for your patience and grace, but also listening to me share about what we think is a really, really important step for the peer support workforce.
Awesome. Thank you, Kelly, so much. There are a couple questions that there's one around the renewal and the fees associated with that. Can you speak to that?
Yeah, that's a great question. So the renewal is every 2 years, and it's a $200 renewal fee.
Okay. And then there was another one around kind of the timeline, and it was how soon after the completion of the hours. But I think it's not just completion of the hours, it's also the completion of the mandatory training as well. So once you've completed the 3 hours of required work, and then one of the recognized trainings, how long after that should an individual wait to actually take the test?
Once you meet the requirements, you are free to take, that you're qualified to take the exam. I think what could be helpful in judging your comfort is going through that document that we have about the core competencies to see, you know, either, hey, this was in my training, I know this, like the back of my hand, like I know trauma-informed peer support, awesome. Here's something that I don't really understand, and like being able to gauge, you know, how much studying do I feel like I have to do? Do I want to do any extra training beforehand? But once you meet the requirements, you're good to take the exam.
And then if an individual takes the exam and does not pass the exam on their first try, what are the next steps, and what are the costs associated with that?
So folks are able to retake the exam within the next 6 months, and I don't believe that we have a charge for the second time that you take it.
Okay. And then one of the other questions was really around the livable wage. And this is coming from an individual that lives in Los Angeles, where the cost of living is quite high. And so basically would be equivalent to having individual required to make at least $28 an hour.
Yeah.
And I think that's something I don't want to, you know, you can add on to this, Kelly, but I think that is something that is outside of, you know, your scope, because it really has to do with the employer, and they're going to be setting those. But I can say, as an organization that has a team of individuals that do have their NCPS and are working within the Kaiser, you know, private sector, they are making a livable wage, and they are making above the figure stated, which includes full benefits. So there's definitely a great potential opportunity to make a livable wage.
Yeah, just would second that. And I think too, a lot of what exists is framed around Medicaid reimbursement rates. Pretty much everyone in behavioral health is paid abysmally relative to the value that they provide. I think more broadly, in terms of changes in the field, there's also a movement in healthcare payment towards literally reimbursing people for the value that they provide, but also just like rethinking of, you know, how we monetarily value different types of services. And I think peer support is continuing to demonstrate its impact on cause. You know, that's not the primary thing that we all care about, but I think for payers it's one of them. And I think that advocacy can come from within the peer world, but I think also we hope that expanding, you know, Medicare pays better than Medicaid. So expanding into Medicare can help drive that pay, and same with getting in the private sector as well. And we hope that those increased wages can help kind of raise all of them.
And I just want to say, you know, in California with the Mental Health Services Act, you know, it's calling for clients to be leading this, and that is incorporating, you know, budget allocations. And so I just want to put that out there, because people do have a right to have input on the ranges of pay that we have for all of our various positions within the behavioral health field through that are funded through the Mental Health Services Act. So please do keep that in mind. And I did get a couple private messages regarding if this presentation is going to be available. If you go to your control panel, you will see at the materials tab, I have the PowerPoint presentation for you saved there. So feel free to open that up and save it, so you have access to it now. Also, we provided the access handout on, you know, what is a peer, and it really breaks it down for you. And then that concludes the questions that we received in the chat box. I know we've gone over a few minutes, but I would like to open it up and just ask you all, if you have any additional questions that you'd like to ask Kelly, please do so. And please take down her contact information, because she'll be happy to follow up with you, you know, after the webinar. And oftentimes, you know, questions will come to you after the webinar. So please don't hesitate to reach out to her. Are there any other questions for Kelly? All right. Well, Kelly, I think that concludes it. Thank you so much, Kelly. I'm sorry that we had a little bit of technical difficulty, but you are a professional, and I just really appreciated it. It really went off without a hitch, minus the fact that, of course, you can't see. You're flying blind, but you've done that. You could do this in your sleep, right?
Well, I appreciate the opportunity to share, and folks for listening. And yeah, as we just said, any questions you have, please don't hesitate to reach out.
Wonderful. All right, Kelly, take good care. Thank you all so much for joining us. I do want to close with saying that our annual conference, due to COVID, has been moved to a virtual platform. I'm super excited because Kelly, along with Patrick and Amy Farrington, who's with the Florida Certification Board, are going to be our keynote presenters this year. Our theme and all of our research has really been around peer support, and really where are we with that now, and with the MHSA passing back in 2004, we've really been looking at the outcomes within local communities and across the state. And so we're just so happy to be able to have you join us, and keep an eye out for more information to come. And with that, have a fabulous afternoon, everyone. All right. Thank you, Kelly. I'll be in touch later, okay?
Great. Thanks.
Bye.